One of the things I believe in our community is the employee giving campaign, and I believe in Ukiah Valley Medical Center, that we make a difference in this community that is necessary for this community to be a great place to live.
Building a new emergency room, how exciting is that, and a new ICU? I think any of us that have spent time around Ukiah Valley Medical Center and have been into the emergency room know that we're due for an update.
When I came to this community, there were 3 hospitals servicing it. Slowly it's gone down to 1 hospital. And this hospital needs your support and your help to continue growing and servicing the community where we live.
The emergency room today was built in 1976, a long time ago, and we still use the same, maybe a little bit more room than they used at that time to treat patients.
Yo di la hora de donación porque me pareció que fue buena idea lo que el que ellos hayan pedido una hora, porque van a agrandar el hospital y también porque tendremos mejor cuidado para más enfermos y habrá más oportunidades de trabajo, tal vez para nuestros hijos en el futuro, no sabemos.
We've got the equipment, we just don't necessarily have the room for it, and it really does at a certain point start getting in the way of quality of care when you're tripping over equipment, tripping over one another. You just don't have enough room. In terms of patient confidentiality and comfort, it's also, this is going to be a huge thing to be able to have the facility that will allow us to give the kind of care that our staff are ready to give if we have the facility for them to give it in.
My parents, my grandparents have been patients here, my kids, now my grandchildren, and every time we've had to have any kind of care here, it's been just excellent care every time. And I think as a group, the employees of the hospital really try to perform to that level for everybody that comes in. And I think that in order to support that, you have to have a modern facility.
I can't tell you what a hospital will look like in 30 years. It's going to be way different than what ours looks like today. But my gift helps assure that the hospital will be here 30 years from now, and so it's very important.
I've decided to give back to UVMC because not only is it my future as an employee here, but also the future of all of our patients and their well-being and the health of our community.
I think it's important because if we get new equipment and just make it so much better, improvements in either area, we can better serve the community.
The reason that I'm making a contribution to the capital campaign is for the new emergency department.
It's just great to contribute back to where you work because it's our livelihood, and not only are we contributing back to the hospital, but in turn contributing back to the community by building the facility, because we're going to be able to provide possibly more jobs and bring in more money to our community.
Pienso que es importante donar dinero para esta campaña. Yo doné también para el hospital y quiero y espero que ustedes hagan lo mismo. Todas mis compañeras de trabajo, les pido que donen dinero para esta campaña que es muy importante para el hospital. Espero que sepan responder porque el hospital ha sido muy bueno con nosotros, muy generoso.
I think people should donate because I think the hospital is just key in our community. We all at some point in our lives need the hospital services, whether it's on an emergency basis or just routine lab work. And I think it's important to have a good hospital in our community.
When people are in need, the hospital does help.
If I need to use the ER services in the future and we've got a technology that will save my family member or friend, then it works out for both of us.
One of the questions that when people are trying to make a decision that they often ask is, so if I do this or I don't do this, will somebody die? And, most of the time the answer is no. But when you're thinking about an emergency room, will people die or an ICU? They could. If people we don't have enough people to work there, if we don't have the appropriate equipment and supplies for people, somebody could die.
I'm encouraging everyone to, give as much as they feel comfortable with, and like just a little bit makes a big difference.
I'm very grateful to have a job here, and I'm glad that I can give back.
I wouldn't feel right asking people if I wasn't giving for myself, so I'm giving it up. So you guys reach in your pockets, look at your hearts, and see what you can do, and let's make this happen, okay?
Our employees support this hospital. When I tell a donor that, a prospective donor, they say, really? And when I describe the level of giving by our own employees, they are impressed, and they have a sense that we appreciate the importance, a real appreciation for the importance of healthcare as a long-term asset of this community.